Thank you, Nash. Okay, so hi, everybody. Just to be super clear with everybody, this meeting is about the BTEC AAQ and health and social care. We won't be using this meeting to discuss any other qualifications, be that sport or science or anything like that. This meeting is just about BTEC health and social care, and it's specifically just about the level 3 AAQ as well. There'll be a little bit of information towards the end about level 2, but this meeting will not be sort of focusing in on any technical content or anything like that. It's just about the level 3 AAQ. So I just want to be really upfront with you about that, just in case some of you have signed on thinking we'll be discussing the breadth of the suite. We won't. We'll be focusing mostly on level 3. I'm going to take this opportunity to just put a poll on the screen. Now, when it comes to the creation of qualifications, what we like to do at Pearson, what all AOs like to do, is to work with centres to have focus groups. And what that involves is getting a few of you, a number of you, around a table, virtually most likely, to actually have a look through a qualification that we've created, usually before anyone else gets to have a look at it, which can be quite good, quite useful, and to just get your feedback, how you think it's going to run, whether you think it's going to work for you, for your learners, for your centre. We just like to get a few of you around the table, really. And obviously there are going to be future developments happening, and it would be great ahead of time if we could capture some of your interest and your contact even details ahead of time. If you don't catch this poll right now, don't worry. I've got 2 more versions of exactly the same kind of poll to release. So if you need to just take a few minutes as we go through this conversation, and maybe you'd like to have a look at the end, then that's absolutely fine. I'm going to be releasing the poll again at a number of different points where we'll just have a little minute to pause and reflect. So I'm going to take this chance now to end this poll. As I said, you will have further opportunities to join in though, but it's great to see that so many of you do want to work with us and want to have some kind of influence about the future for your learners and for our learners. So that's great. Okay, I'm going to end the poll now. Thank you, everybody. Okay. So hopefully everybody can see my screen. They can see the start of my presentation. And I'm going to take you through what it is that we're going to be discussing today. So this presentation, as you will be very aware, I'm sure, is kind of coming after the announcement by the Department for Education, which occurred really just before the holidays. It was early December that DfE were in the House of Commons, and they announced most of the results of the rapid review. I say most of the results because we're actually still waiting to hear some of them. But we're going to talk about that first and foremost. That's going to be our priority this afternoon. We're going to look at the funding list for health and social care moving forward, how you may go about planning your curriculum, and that will involve resources and support that are going to be coming your way, some of it imminently. And we're going to briefly touch on level 2, and then I'm going to provide you with some links for some resources you might find useful. And then I'm really hoping we'll have time for some Q&A, where, as Dash said, you'll be able to unmute yourself to ask questions directly, because we like it when we can see you and speak to you. And that's one of the reasons for the chat not being enabled right now, is we want to be able to save our questions for the end, because what we tend to find is people have the same question, maybe just phrased in a different way, and we end up answering it throughout the presentation, or someone will ask it at the end, and then we kind of manage it maybe once, maybe twice, rather than multiple different times. So we're going to move through now and hopefully just share with you some information that you might find quite hopeful at this moment in time. I won't go into the full details of this slide, because you will have had me or someone else go through this timeline of events multiple times by now. Really, the key dates really are from 2024, which is when we have the general election. I'm sure you'll remember. And of course, what that meant is that there was a whole new cabinet put in place with regards to the education sector. And that was the kickstart really for the rapid pause and review, which is what concluded in December. And we're still waiting for a meeting with the Department for Education that should be happening next week to go over some of the finer details of what that pause and review outcome looks like. Okay, but we do have some news. I just don't have the full picture for you yet, but we will in due course be setting up further events so that I can share with you the full picture. Okay. But that rapid pause and review was announced last summer alongside, and some of you hopefully have fed into the consultation for the curriculum and assessment review that started off also in July with the aim for that to conclude at the end of August of this year. So there is a lot going on in the education space right now with regards to having a look across the depth and breadth of all qualifications available to learners and just sort of see where they're all sitting with helping the country move forward really with its skills and workforce. 2024-2025 does see some reversal of defunding decisions for health and social care. I'm going to go through that with you in a second. And wave 4 appeals were also announced last November, but we were part of wave 2, so that won't really affect us. So the rapid review, I'm sure you were all waiting on bated breath, much like we were. I can absolutely promise you we did not know the outcome of it before any of you did. They very much kept us in suspense, the Department for Education. And when you've got these slides in front of you, you should be able to see them through the resources link, but also you'll get sent them later on as a matter of attending. You'll be able to look at the full brief of courses that are being defunded still, and that will actually get a bit of a reprieve for a further year moving forward. Okay, so you can have a look at that, the full document in your own time. It's on our website. Really the key things that we want to talk about are the ones that relate very specifically to health and social care. I'm very sorry, much like some of you, I'm still trying to get over a bit of winter flu. So my voice may come and go. I'm very sorry for that. What the outcomes really mean for Pearson, for us, generally speaking, as a BTEC suite, is that the Cycle 1 subjects, which were the ones, Cycle 1 was chosen in line with the T-level release, so not quite health and social care, they're carrying on this year. So if you do anything to do with early childhood development, or child development generally, or early years, or children's play, learning and development, then that's continuing on as normal. Okay, the rapid review kind of focused a great deal more on wave 2, which health and social care was a part of. The key thing that you need to know is that all RQF BTEC nationals in wave 2, so that does include health and social care, all 180 and 360 guided learning hour qualifications will remain defunded from this year. Okay, so we have not had a reprieve for our small sizes of RQF qualifications. You'll see this in a visual format in just a second, but this is really key information that you need to know. The 31st of July of this year is the last chance you will have to register people on the RQF 180 or 360, okay? You will not be able to do that from the next academic year onwards. You'll see it in a second. The 1 AAQ and 2 A-level study program, that's been reversed. They have said, don't worry about that, park it. It's not necessary. You as teachers, you as centres, you can now design a program of study as you see fit. Okay, now there are obviously things to consider with that, and we'll talk about that just a little bit later, but you no longer have to deliver A-levels with an AAQ. Okay, you can if you want, but you do not have to. And as you'll see, each sector's funding is very bespoke, and we're still trying to kind of iron out those last details that we think are going to impact on health and social care as a sector, and we'll know more next week. Okay, so I promise I don't have all the answers right now. I have some, but I will have more in the future. So this is our visual representation that I wanted to show you, because sometimes having things done like this makes so much more sense than seeing it as bullet points. So moving forward, we did not get any kind of reversal. I'm very sorry, I'm going to sneeze. I'm very sorry, in the middle of a presentation. There was no kind of funding reversal on the 180 or the 360. Okay, so from September, if you want to deliver the 360, it has to be the AAQ. Okay, that AAQ is in no way nested in the RQF. okay? They are very distinct qualifications. So if you have someone on the 360 in the AAQ in September, you cannot top them up to the extended diploma, RQF. I hope that makes sense. Trying to be really clear. They're very distinct qualifications. They are in no way nested, okay? So you cannot do that. We did win funding reversal on the 720 and the 1080 size. So for those of you who deliver the national diploma and the extended diploma, you've got another year in which to do that. And what that means for us is that gives us a bit of breathing space to have conversations with the Department for Education to say, right, what can we create in that larger size space? It's inevitable, I think, that everything is going to move from the RQF framework to an AAQ framework. I think that is government's ultimate aim, DfE's ultimate aim, is that AAQs are going to be the gold star going forward, okay? The RQF, in its due course, it will all be switched off. What we don't know is what we can have is an awarding organisation in that 720 or 1080 space. Okay, so to be really clear, RQF in September has to be the 360 AAQ. The AAQ is not nested in the RQF. They're very distinct, so you cannot do that. We'll talk about what you might be able to do, but it will cost money. Okay, that's the thing that you need to remember. If you want to kind of move people over to quals, different qualifications, then that has funding implications and that has monetary implications. But that's kind of the key thing. So big wins, 720, 1080 still exist for a further year. Will they exist beyond that? We don't know. What we do know is you can register students on those courses in September, okay? And they will still get 2 years of funding. So if you start someone on the extended diploma this September, you can continue that 2-year program with no problem whatsoever, okay? So that's good news. We were expecting massive change this September, and actually we've got a little bit of breathing room, which is positive in many ways, okay? So what might that mean for curriculum planning moving forward? And this is what I've already said some of this to you, okay? So this is a bit of a sort of repeat of that information, but I really can't emphasize the importance of it enough, because what I don't want is for you to be caught out by kind of not understanding or not realizing that this is how it's set up to move forward from the autumn of this year. So the funding implications that you really need to consider are that if you register someone on a 180 program, let's say now, they're doing the 180 now, you must, if you want them to do the 360, you must move them over. You must put them on that top-up registration the way that you would normally do it before the end of July, okay? If you do not do that, they cannot register on the top-up. It won't exist. It can't happen, okay? So for those of you that were incredibly hopeful and did that 180 this year, don't. Hopefully you haven't. But if you did, you must register them on the larger size, the 360, before the end of July, okay? Because that course will no longer exist. It will no longer be available to you. If you are someone, if you're a centre who would traditionally do a top-up program, like first year you do the 360, second year you do the 720, same rule applies. You must make sure that you register those students as soon as possible, okay, for this year, because next year you're not going to be able to do that. You need to think about how you're going to make your study programs work. I completely appreciate, by the way, that this news is coming quite late in the academic year. I know that you will have already been doing open evenings. I know as a teacher, I will have done, I don't know how many by now, and I will have spent, months saying to teachers, saying to students, saying to families, we don't know what's happening in September. I appreciate that this news will feel very late. We're giving it to you at our earliest opportunity, as soon after DfE gave it to us. But it does mean you can have some registrations on larger sizes from September, but you need to think about what you're doing for this year's learners. okay, for these people that you're teaching right now. If you want to get them topped up, do it as soon as possible, but you're not going to be able to do it for all sizes, for all courses. The problem you're also going to have is learners who need to fall back onto qualifications that have been switched off. So I don't know how often you may have this scenario where someone leaves partway through a program. Okay, I had it happen. Sometimes it does happen, right? For many reasons. There will be difficulties for students who need to fall back onto programs that have been switched off. So that will become a bit of a difficulty. We're in talks with the DfE about how that gets managed. And as soon as we have information, we'll be able to share that with you. Hopefully, it won't have a detrimental impact on your learners. But from September, really do think about how it is you're registering learners, because you will only have, from the RQF side, you will only have a 720 and a 1080. Okay, that's it. You will not have smaller sizes. So you can't register someone on the extended diploma and they only complete the certificate, for example, for various reasons. You won't be able to drop that person down. Okay, they'll count in a negative way against your data. So I just want you to really understand that. There is some guidance about transferring learners, which I think you kind of maybe need to digest on your own, because this slide is, it was provided for me and is very information heavy, okay? There is a lot of guidance on here, and there's links as well, which will prove useful to you down the line if you need to, but it's really focusing on where you've got that kind of 1-year model to a 2-year model, and where things get a little bit messy with dates, maybe you missed a deadline or something like that, then there is this possibility of transferring learners, but there are cost implications for that. As you will see when you look at the guidance and you read through the slide, there are cost implications to missing deadlines, okay? And I'm afraid that there isn't very much I can do about that. So please do keep your eye on the date, especially as you get into the summer term when things get really busy, that's exam season again, and all of that kind of stuff. Just make sure you've got a note in your diaries about 31st of July, and make sure that if you are one of those people who needs to do a top up, because this year that's what you planned for, you must do it, okay? Because otherwise your centre will have to pay twice, essentially, for a learner. So please make sure you've got a date in your diary. Now, I mentioned study programs earlier on, and how actually there's been a bit of a reversal on that. The main point that you can take away really is that the study programs that you create need to suit your learner's destination. They need to align with UCAS guidelines, and they need to align with HEIs, so universities, and what it is that they want for their courses. So it might be that you've got good relationships with universities in your local area. Talk to them about, if you have this study program with an AAQ, then what might they want learners to do alongside it? We publish some of this guidance within the AAQ specification, but because the guidance now from the Department for Education has changed, and you get to decide on the program of study, you can, sorry, I managed to touch my mouse pad and jump. You can do as much of a mix as you would like to. So you can see I've put some examples there of the AAQ in health and social care. You can do it alongside a small sized RQF in sport and an A-level in biology. Maybe you've got someone that's particularly interested in physiotherapy, for example, as a route. You could do an AAQ in health and social care, an AAQ in medical science, and an RQF in uniform public services. Hypothetically, okay, because that's still a scenario that we need to test ourselves with HEIs. I'm just giving you some examples of what your study program might look like. Of course, for September this year, going to next year, they could have the 1080, okay, in which case we all know where that goes. But in the future, these are the kinds of study programs you might look at. But as I said, I cannot emphasize enough that your role as a centre is to make sure that whatever it is your students are signing up for, that's going to work for them getting into university. If that's their destination of choice, then it's about your centre designing those study programs that are actually going to get learners into the degree programs that they want to. Okay, so please make sure that that's something that's on your radar moving forward, because as exciting as it is to be able to design your own study programs, what we don't want is people falling at the last hurdle where they're applying to universities and then universities come back and go, well, that wasn't something we considered, actually. You know, we're working with them, we're putting to them all these different scenarios. It just takes a little bit of time to get them on board and to get them to agree. They were perfectly happy, by the way, with the AAQ and 2A level model. They were perfectly happy with that. That is not a problem. If that's what you are proposing to deliver from September onwards, absolutely fine. You shouldn't have an issue with HEIs being on board with that as UCAS application information. It's just those alternative study programs, which we can now put in place. Those are the conversations that we're having, okay? But potentially really good news, because if you have a cohort of learners who really genuinely do prefer the vocational programs of study, it's opened up for them. You know, they are now not going to have to do 2 A levels with an AAQ, which is great news. Yeah. If you were all prepared, and maybe you were, because, you know, until December, we all thought you had to deliver A levels, and maybe you've done extra training or whatever, you can still do that. You can still deliver A levels. It is entirely your choice as to the study programs that you put forward for learners. But just please be certain that they're going to enable your learners to reach their destination. So the qualification structure, and, you know, thankfully we're getting almost to an end point of me talking when you get to ask some questions, which would be lovely. But this is the qualification structure, the difference. So on the left-hand side of the screen, you can see the AAQ, the BTEC AAQ, and on the right-hand side is the current extended certificate. Now, the good news is really that we're going to talk about resources in just a second, and all of the support that's available for you. And actually, there is quite a lot that we've got going in terms of what's available for you. So there will be textbooks, there will be revision guides, there will be student books, there'll be training, and I'm going to talk to you a bit more about training in a minute. But really what I want to emphasize is that where we can, for the AAQ, we had to go down the road of looking at what was it across the health and social care suite that universities were wanting from students with regards to them being able to progress into a health and social care based degree program. Okay, and we know for a lot of them that the biology was actually a key aspect. We couldn't ignore that in developing the AAQ, because we were under the impression at the time that we would not be allowed any kind of continuation of the RQF. You know, the previous government had been really firm on that. There will be no changes to this defunding table. You will not be able to keep the larger sizes, and you won't be able to develop larger sizes. So what we had to do was really talk to HEIs about the kinds of programs that they thought would be of value to them with your students moving forward. And that's why there is biology in this alternative academic qualification, the small size AAQ, which isn't in the National Extended Certificate, the current one, okay? Because that one is nested and it is part of the larger 1080. And in the 1080, you will see that there is a biology unit, as is it's there in the 720 as well. What that does mean is we've got resources available for you already that you can go and have a look at. You can kind of get yourself familiar with if you've not taught human biology and health before. I think a lot of it, if you look in Exam Wizard, for example, I'll talk to you a bit more about Exam Wizard in a few minutes' time, but Exam Wizard, I'm sure some of you have used it, at least for Unit 1 and Unit 2. You get to create your own papers. And there is a good portion of the new Unit 2, Human Biology and Health, that is based on the old Unit 3, which is it's Anatomy and Physiology, okay, in the RQF. So there is a lot of crossover. So when it comes to the full development, the full complement of resources available to you, you will see already that you can start to create those papers, those sort of questions around human biology and health based on the current, the RQF Unit 3. Where it differs really is the second half of the unit, which is about health conditions. And you will only ever be sort of finding that your students get tested on those health conditions. It will never go outside of those conditions listed in the specification. It will only ever be at a level 3, so it's not going to extend beyond to things that we wouldn't expect you to be able to teach them, and for them to be able to know, reasonably speaking. And that's why we're so specific in the specification, because we didn't want there to be any room for kind of confusion moving forward. We didn't want anyone to be surprised. So where you can see, you know, the health condition, then you've got your primary body systems, your secondary body systems, and some other information. The exam questions are only ever going to be based on that type, that content within the specification, which is a positive moving forward. But it was really important to HEI to have that there. I'm sure that you can understand why things like health and social care practice were really important, and that really is a combination of Unit 2, Unit 5 as well, some of Unit 12, maybe, but also for those of you that deliver Unit 14 in the extended certificate, there's definitely some crossover with that in the Unit 2 for the AAQ as well. So hopefully you will find, when you kind of get into it and when you really look into it, that there isn't a great deal of new things that you have to do. But do remember, this is a brand new qualification. It is distinct from the RQF. It's not meant to be a kind of like for like. It's very much meant to be standing on its own. And so we did have to kind of go into what that meant for HEIs and for progression. If you've looked at the transition guide, and I really hope that you have, it's linked at the bottom down here. You can see this sort of green highlight there. That's a link directly to the health and social care transition guide, which just summarizes some of the key differences and similarities between the AAQ and the RQF. We're still keeping pass merit distinction, which I think everyone will be familiar with if you've been with BTEC for well, a very long time, probably. You'll be very familiar with, even if it's actually quite new to you. Hopefully you're getting your head around pass merits and distinctions. There will be some familiarity in unit content across the board, but there is new unit content. It's brand new qualification, but it's an exciting qualification. You know, it's more forward thinking. It's more aligned to the here and now. The RQF, I don't know if any of you thought about this actually, but the RQF was developed 10 years ago. So although it was a 2016 specification, it was actually developed 10 years ago, which means it's incredibly old in relation to the sector, and also in relation to sort of where we are now in industry. So it's definitely due an update. And obviously, of course, I've mentioned to you before when it came to launch events about the number of HE partners we had, and industry boards and professional bodies that were involved in the creation of this. So, you know, please do look at the transition guide. It was created very much to just help you all kind of see where those similarities and differences lay. So please have a look at it. It's linked in the document, which hopefully you've got access to the slides already within the resources. But yeah, if you don't, you will get the slide deck at the end, and then please have a look at it then. So resources and support. This link here is a link directly to the training page for Pearson. I'm going to show you some events that we've got specifically for health and social care very shortly. But this is a summary of our training offer. So spring term, so that's this term up until the Easter break, there will be getting ready to teach events. I'm going to show you some dates for those so that you can sort of look for those and find them. Getting ready for internal assessment, because obviously that's a little bit different moving forward. We're working with a PSAB model as opposed to, at the moment, you can use AABs or you can totally create your own. We're moving away from that, as we talked about in previous sessions. There are going to be bite-sized videos available for you that are going to look at exemplar delivery, but again, not us indicating in any way a firm way for you to go. It's just giving you an example. We're also going to be looking in the summer term for more events for you to attend. But for the time being, we've got all of these events listed on our training page. So if you remember, you click on this link here, okay, and it will take you to the main training page. You then filter to health and social care, and you will find all of these events listed. So the top events from the top line to this line, they're all the getting started. So getting ready to teach in the old language. So that's getting ways to plan and teach the BTEC AAQ. The last two are for internal assessment, and they're stretching all the way from the 5th of February, which actually isn't that long away. January has flown by, and they're pretty regular, you know, once, twice a month. Health and social care tends to be quite well subscribed to. So if at some point we find that we get oversubscribed, we're very likely to put on more events, more training. So please do get your names down to access some of these training courses, just to kind of help get your head around things, to have a look at things, see what's available for you, and how that might sort of help you in moving forward when it comes to planning for September. Just gonna have a look. Okay. So moving forward, we have got a Delivering BTEC page. You, I've no doubt, have also seen all of these other resource pages that we've got available for you. There's Exam Wizard, Teaching, Learning and Support, there's Results Plus, there'll be access to scripts, and of course there's a subject advisor. We'd be nothing without Esther. So Esther is always on hand to speak with you, meet with you, both if you really need it. But Exam Wizard is going to be available. That's we're currently going through a bit of a mapping exercise at the moment to make sure that there are very specific things available for the AAQ. That obviously at the moment is going to be based on our sample assessment materials, and also if we find that within the RQF units there are any questions that could reasonably be used as a way to kind of map over to the AAQ, then that's exactly what we'll do. And of course, as we have more exam series, we will then build up those resources. You will have Results Plus when you have the opportunity to have the first exam season. You will be able to access scripts in the way that you do now. Hopefully everyone has got their edXL Online account and can access those sorts of resources that are available. Paid for resources, I kind of anticipate this being a question that everybody is going to have. We will have samples available by the end of the month. So there'll be sample pages available. That's usually the first unit. That should be available on the website by the end of January, with the full complement of resources, the full published resources available hopefully in April. Obviously we cannot account for, you know, writers falling sick or ill or anything, so please don't hold me to April or a particular date in April, but that's our intention. Okay, so sample available materials for your student book and for your textbook at the end of this month, and then the full published articles, which you'll be able to buy either online as an online version or as a paper-based book from April of this year. You can see, I don't know how many of you will teach across multiple sectors, but you can see that everything for wave 1 and wave 2 of the new qualifications are going to have quite a lot of resources. So there will be teacher packs available for you, which will kind of help you with lesson planning, lesson ideas, etc. And actually what we're currently creating for you is a teaching and delivery pack. So we're moving away from delivery guides, which you are probably quite familiar with. We're moving away from those into providing for you teaching and delivery packs, which will give you an idea of how you could structure your study program, how you could teach units. We'll also give you ideas within sort of a kind of framework of a scheme of work, but not exactly a scheme of work, but it will give you ideas for starter activities, for group activities, for individual activities, also resources with links, so links out to things that you could use for particular lessons. But by no means is it meant to kind of replace the scheme of work that you all put together and work so hard to put together. But this is it's a meaty document, okay, that we're going to be providing for you quite soon. We're just getting in the final elements of it now from our external writers. We'll be going through some checks just to make sure it all makes complete sense. And then you will have really quite a comprehensive pack to help you in sort of planning through the AAQ. Like I said, there's going to be an awful lot of information in it, but it should hopefully get you started with regards to where you could go for resources, for lesson planning, for anything really that's just going to get you started, helping you move forward. I'm going to take this opportunity to just put the poll out again, because I'm about to go into a bit of a level 2 conversation, but I just want to give you the opportunity to share your interest in joining focus groups. If you have already answered this question, you do not need to do it again. It's only those of you who didn't get around to it last time. So please, you do not need to repeat yourself, okay? It's just if you didn't have that opportunity when I first released it, now you absolutely can register your interest. And as we get to the end of the session, I will undoubtedly release the final version of this. So again, if you miss it because you're trying to do 12 things at once right now, do not worry. There will be a further opportunity for you to register your interest. But yeah, as it starts to kind of plateau out, I will close the poll. I'm going to take the opportunity to have a drink of water because I can feel my throat is going getting very dry. But it's really nice to see how many of you do really want to be involved. Like I said, it's very important to us that we work alongside you, we work with you in trying to do the best for the learners that we've got currently and the ones that we've got coming, because they've had such a different educational experience, haven't they? Those coming into college now have really not had the school experience that we would have hoped that they would have. And even the ones now coming into their GCSEs, their early school experience was so incredibly different that we need to be more aware and more focused on completely different areas than we had to be 10 years ago when the RQF was developed. Okay, so I think that's sort of plateaued out, so I'm going to end the poll again. And then what we'll do is I will move it on to level 2 briefly. Level 2 is there's no nice way to put it really. Level 2 has been paused. We have created a level 2 qualification, currently going through its sort of final checks and balances right now, but the Pearson review that we've just been through, that we had the results for in December, really only focused in on level 3. What we know is that the cycle 2 groups does include health and social care, so that is us. That's why we've got this qualification that's sort of ready to be uploaded to the DfE portal when it comes to it. Its intention, of course, was to be first teach next year. What we're actually doing is extending the current BTEC firsts. So they will be extended. They're already extended until December of next year. So they're still ongoing with certification in 28, but actually that's going to be moved on. We're doing a kind of big moving forward for the RQF, because we just don't know what's going to happen. It's a bit of a shame because we were quite excited to have a new level 2 qualification out there, you know, where I've said the RQF is 10 years old. Well, this one is even older. This one was developed in 2012. So yeah, I remember being part of the pilot group delivering this qualification back in 2013. It's definitely been around for quite some time. So very excited to be able to move on to a new level 2 at some point in the future. As I said, we do not know exactly when that is. We're hoping that we will get more information next week. Whether or not, though, the conversation will actually focus just on level 3, I do not know at this point in time. So this is the bit about useful links, which I told you about earlier on. I mentioned I'd give you some useful links. Really, that's kind of the general BTEC information that goes across multiple sectors, multiple qualifications, but still very useful for you to have a look and have a read, particularly at things like the funding guide, which hopefully will make things sort of clearer for you moving forward. Now, next steps, and maybe there's a bit of good news for you here. We do know that part of Pearson review did open up opportunities for awarding organisations, of which, of course, we're only one. to be able to submit smaller sizes of the 360 qualifications that we developed. So we will be submitting a 180 AAQ. Okay, now that is not going to be available to teach this year because the Department for Education take quite some time to come back to us. It's going to be based on units within the AAQ, so it's not going to be anything kind of brand new that you will not have experienced already, but it will not be available this year. It'll be available from 26. So September 26. So that means there will be two sizes available. There will be a 180 AAQ, BTEC AAQ and Health and Social Care, and there will be a 360 BTEC AAQ and Health and Social Care. So we are intending to put that forward. And like I said, hopefully that is some good news for you moving forward. I know in past events, a good number of you have asked about a 180, and we've just had to sort of keep information under our hats, really. But that's how we're going to be moving forward, and hopefully we'll be able to do something really positive in the larger size space when we've had more discussions with the Department for Education next week. Because as you know, health and social care is a massive growth area. It's a big focus of the economy, a big focus of government, and quite simply, we're not going to be doing anybody any positives by reducing the number of pathways into the sector to simply T levels, A levels, and 1 AAQ. So hopefully there's some really positive conversations to be had from next week with people. Couldn't possibly end without, embarrassing Esther just a little bit by having her picture front and center on the screen. Esther, as I'm sure you all know, is the subject advisor for health and social care, but also for early years, and also currently, while we're still running it, for applied psychology. So please do reach out to Esther with any further questions. Sometimes she will loop me in and you'll get a response from both of us.